Hello everyone, my name is Tsuyoshi Isojima. I'm pediatric endocrinologist at Department of Pediatrics, Teikyo University School of Medicine in Japan. I have been doing translational research in relation to bone and growth. And I'm also an editorial board member of HubLE. Today, I'm here on behalf of HubLE to interview with Tian Nie, who presented her work at ANZBMS 2021. Hi, Tian. Could you please introduce yourself to HubLE audience?
Hello, thank you so much for having me. So my name's Tian, and over the past week I presented on my PhD work, which uses preclinical animal models to look at the effect of gender-affirming hormone therapy on bone in the context of transgender patients. So for the conference, I specifically presented on the prepubertal transitioning model for transgender girls, where we took away testosterone in young male mice through orchidectomy and then gave them estradiol at a later age. And then at adulthood, where the bones have finished growing, we took the bones and we imaged them, and then we also underwent strength testing.
That's interesting. So, what is your key finding of your study?
So the key finding of our study was that supraphysiological doses of estradiol in a prepubertal mouse model protects against orchidectomy-induced bone loss.
That's very interesting and sounds nice for clinicians. So, what is the implication of your study, especially for the clinical practice or the future study?
So in transgender clinics, it has been seen sometimes, and the data is still a little bit inconsistent just because there is not that much studies out yet. But some studies have shown that in transgender girls and transgender women, that they have decreased bone mineral density and slight increases in fracture risk compared to the cisgender general population. So then the findings of my study is that supraphysiological doses of estradiol may have bone health implications. However, there is a lot more that needs to be understood and studied, particularly because supraphysiological estradiol may have other side effects. And a lot of the bone cell mechanisms are still not well understood at this stage. So lots more to look at.
I think this is the first step to for the for that kind of patients. Yes, I think it is a very good study, and I'm looking forward to your future study. And by the way, what is the next plan for yourself? What's next for your work? What are you going to do in your future work?
So my future goal is to first graduate, and then I would like to find a job, as most graduates do. I would like to do a postdoc and then preferably find a way to incorporate my work in both research as well as potentially bringing it to the patients in a way, finding ways to help people through research and then bringing that to the patients.
Yeah, that's great. So I hope your success in your future work, and I'd like to thank you for accepting our invitation for the HubLE interview today. Thank you very much.
Thank you so much for having me.
Thank you.